We have a very strong and competitive fellowship program. We really strive to provide top-notch training for our fellows, and we make sure they're exposed to a wide variety of different clinical scenarios, so they're well prepared to practice after they graduate.
In order to have a true impact on the future of endocrinology, you have to be part of medical education. And so over a number of years, we carefully planned and developed our program so that it is top of the line.
When I was a third-year medical student, I had the chance to work with pediatric endocrinology on a rotation, and I fell in love with the field at that time. So when I started looking for pediatric endocrine fellowships and saw that the fellowship had been started here, I was extremely excited. And then when I interviewed here and met with the faculty, I knew that this was where I was meant to continue my training.
The hospital in and of itself is the only freestanding children's hospital in Kentucky. And so because of that, we capture children and families coming from across the state. And so there's a really wide variety of pathology that we see, which of course, if you're a learner and you're in training, you want a diverse experience so that you're well prepared when you're actually ready to practice independently on your own as an attending physician.
We see a lot of patients who are from minority racial and ethnic groups. We also see patients from different socioeconomic backgrounds, and a lot of rural communities will travel to Louisville for care. So we have learned a lot about the different dynamics that impact their care.
The team really goes above and beyond to help you to really be able to cultivate kind of the career that you want and to reach the goals that you're looking for. And so everybody's really welcoming and wants to help you figure out what it is that you want to do. And so I think that's really helpful.
We have faculty that have trained in many different parts of the country, which bring a lot of different perspectives to endocrinology. And one of the things I've learned quickly is that endocrinology is not black and white. There's a lot of gray. And so having these different perspectives really allows you to see how you want to be as an endocrinologist.
We have a energetic, innovative faculty. We have specialized staff that allow us to have programs that encompass all areas of endocrinology.
I'd say that if there's one word that I could use to describe the culture here, it's community. So the end goal that everybody shares is the same, which is to ensure excellent patient care, and then for our fellows specifically, ensure the best education that we can possibly provide.
I think this is a really special place to work. I think that we have a lot of really fun people to work with. We have all different levels. We work in big teams, and we get to really kind of encourage each other and support each other in all different ways in different areas of medicine, and I think that that's really special.
We have a friendly and nurturing culture. I think all the attendings here are very approachable and we get along great. Fellows and attendings, I would say, behave as friends. We support our fellows and we really just want to provide what's best for them.
We have a really strong research program in endocrinology. We do a lot of work in the area of type 2 diabetes and unique training opportunities for individuals who are interested in learning more about how to pursue a career in research. So we work really closely with other parts of the Department of Pediatrics, and we have been able to develop that curriculum to support the professional development in that area.
We perform basic translational and clinical research, and all of those are geared around improving the care that we are able to provide patients so that the future of these patients is assured.
We have the only sports and activities center, which is integrated on our diabetes floor, which helps diabetes patients perform at their highest level.
We want to try to recreate what they're doing in the lab to see how their blood sugars respond, so we can try to help create better plans to manage their diabetes.
We also have a nutrition kitchen here in our training program, and this allows patients to experience chefs, learn how to cook, and help our patients who might have weight disorders or issues gaining weight learn how to cook appropriate foods.
Louisville is a vibrant, growing city. We have everything that you would want in a small town and everything you would want from a big city.
There's so much to do outside. There's parks, there's festivals, there's always something to do, there's all kinds of fun places to hang out. There's a lot of good food to have, a lot of unique different restaurants and places have been owned by chefs. And generally people are just really friendly. And so I think it's a really great place to be.